Hi, my name is Tony Osborne. Today is December 8th, 2014, and this presentation is for CDEC 1359. Today I'll be presenting information on a young man that I observed over a course of 6 weeks. The young man has autism. Using the old diagnosis, it was as Asperger's. I worked closely with the family to gather the data that I'm going to be talking about today. Not as much with the in-class observations, only because the parent was a little uncomfortable with some of the things that was going on in the environment that I'll discuss later. But I did make 6 observations of the child. I used anecdotal records and a data collection sheet that really helped me gather this information. Also, what I did is I used the functional behavior assessment as my primary assessment tool. One goal for my assessment strategy was to have a little flexibility and not be tied to a form. When I'm using my anecdotal records, I could state whatever needs to be stated. And it also gave me a chance to look for specific things as they came up. I also used a pre-existing form that I developed that would help me a little bit with monitoring the duration and frequency of the behaviors that we found. Using anecdotal records also gave me a chance to review documents that the mother provided to me to give me a little more perspective and foundation. The functional behavior assessment was used for several reasons. One is the child's IEP primarily discussed behavioral issues, and yet the school had never conducted an FBA or a BIP and implemented into his program. I also conducted or used this assessment strategy because the parent could use the same strategies at home to get an understanding of the context of the behaviors, the antecedents to the behaviors, and maybe the consequences, and most importantly, the function of the behavior. Why was the child doing it? I also used, the mother provided me the information from the IEP, his 2 goals. I noted early on and discussed with the parent that the goals were pretty general and not very measurable. We discussed some of those issues, for instance, using words like inappropriate without really saying what the inappropriate behavior was. And then they also did not have any way of measuring when he did or didn't do it. So we discussed that and talked about how we could maybe remedy that. Early on in my observations while conducting the FBA, I noted that a key antecedent to the student's behaviors were peer interactions. These interactions would result in him becoming aggressive or sometimes getting his feeling hurt. When he was aggressive, he would kick, hit, push. He wasn't a biter, fortunately. And these were noted because, again, they might have been better used in the IEP to discuss things like what inappropriate meant. He also would get his feelings hurt, and when those things would happen, he would either collapse to the floor and cry or go hide under a table. But those were all things that were the consequences that we noted to the behaviors once the antecedents had occurred. When we basically looked at some of these issues that happened, the parent thought that she wanted to be able to use the FBA at home to kind of get the same feeling, and she had noted that she kind of used one style and her husband used another. We discussed that because we noted that within the classroom, the main classroom teacher was pretty directive. She would even go on record as saying that she was not very supportive of special ed or the techniques used, and said that she knew nothing about autism, and she felt that the child just needed to have a firm, direct hand. The paraprofessional that was in the classroom used another approach. She was a bit more empathic and relationship oriented, and it was interesting to note the differences in the behaviors of the child. When the child would be having a behavior and the teacher interceded, usually the child would escalate. When the paraprofessional interceded using a more of a relationship oriented approach, the child would usually calm down. When we discussed that with the teacher, I didn't specifically, the mom did, it was noted that again that the teacher just did not feel that it was important. It was interesting to note though that the teacher was encouraged to go to a training for children with autism, and she learned a lot, she said, and she even implemented some of them, and they worked, but it just felt inconsistent to her, so she stopped doing it. The activities that we used basically were all driven around his need for social skills and social studies. Activity 1 had to do with social stories, dealing in the social domain and social skills, where with the help from the teacher, the student would script a social story, outlining the steps of asking questions and requesting information. And then the student and the teacher would use a video recorder to record 2 different scenarios. The materials needed, of course, would be a video recorder and a worksheet. Scene 1 would have the student sitting in class while the teacher's presenting the information the student doesn't understand. The student would act out, not raising his hand, to ask for help to understand the information better, and then the student would be given a worksheet coordinating the lesson the teacher just taught and demonstrating not knowing what to do. The student would also demonstrate emotions associated with the frustration and confusion. We felt this would be appropriate because the child was very high functioning. Scene 2 would have the same student, in this case our student, sitting in the class while the teacher is presenting a lesson. With appropriate timing, the student would raise his hand, and then he would ask scripted questions asking for help. So we had the modeling and everything else that was important, and we had the child modeling a successful behavior. We also suggested this could be done at home around the dinner table. Repeated practice viewing the social story would take place until the student was able to generalize these skills into another area. Activity 2 was what's in the bag, and this was something that was dealing with more of the social and cognitive, dealing with the behavior, and it was again to reinforce skills of asking appropriate questions without escalating. Again, they needed to have some kind of bag that they couldn't see through, and some identifiable objects like blocks and pencils and paper clips, and basically just start the conversation by gathering information. What does the child think's in the bag? And it was a good way to have an anticipatory set for this child to kind of get the curiosity going. And then they would start playing a guessing game. They'd place an object in the bag and tie it closed and pass it to the children to let them kind of guess what it is through the fabric. We do it with other objects, and we would accommodate for the nonverbal children. In this case, that wasn't him, but if he was in another lesson with this, that would require you to tap to gain your attention, and then give the picture representing the object. So we use more of the picture cues and all such. The activity extension might be to watch a television show about science or nature and ask the student to ask questions. After everyone has had a turn, then we could have the children ask for information or guess the contents of the bag. Activity 3 for this child was more of an independent work assistance. It was more of a cognitive study skills domain, and it has basically the student will have a visual representation of each goal to be completed on the left side of a card, and then that's what needs to be done. And then on the right side, he would actually have what was actually done. And then on the left side, once it's empty and the right side is full, the child can earn some points. But that shows that there's actually steps and pieces that can be done of an assignment to get them done. The procedures basically would be that the teacher would model this, and actually this is a good skill that the child can generalize into future life. And the student would practice these types of things for assignments using their cards over a week's period. And then at the end of that week, we'll check it for accuracy. If the child's having difficulty with this, then we'll reteach, much like guided practice would be. And if they're not being successful, then we would task analyze it and break it down a bit more. The extensions would be how they could use this to manage chores at home. Before lunch, the student can use these visual schedules. If they're not completed, each one can be evaluated and addressed separately. The fourth activity is how to show emotions and feelings, the social emotional domain. dealing with social skills, and the objective was for the student to describe and demonstrate appropriate ways to express and cope with emotions and feelings. In this case, we would basically have the student look for pictures of magazines with people using different types of emotional expressions. The teacher could then facilitate a discussion about the ways the people show the emotions and feelings, emphasizing that it's okay, maybe even normal, to get angry and have hurt feelings, but we have to be careful when we express the feelings because we don't want to hurt others. Then we would brainstorm a variety of feelings and methods for expressing these feelings in a healthy manner. It would be appropriate and important to make sure that the feelings like frustration, anger, hurt, jealousy, and irritation are discussed so that they can maybe come up with some ideas to suggest to how to deal with it. The way to extend this again in a family environment is for the family to discuss emotions that they're maybe seeing on a TV show or that maybe happened before and get an idea of how to better deal with it. The strategies that can be used for this is maybe spacing, like counting to 10 before a response, or taking a personal time out, stepping away from a situation, and using I statements to take responsibility. Those were the 4 activities, but I think it needs to be noted that this child has very supportive parents, but he's in a charter school it's not probably the best place to meet a lot of his needs. One reason for that is his mother's employed there. She's felt very uncomfortable about discussing the child's needs with the teacher, although she has, and she's even brought it to the administrator, but again was a little reluctant in being too specific. We discussed that and what her rights were, because her son is very intelligent and articulate, but he does manifest a lot of the behaviors that can be expected of a student with autism. Even with those things going on, with the teacher trying things that work but refusing to still do them, and noting that certain strategies work better than others, we did notice some growth with the child, because he does want approval, he does want acceptance, he does still continue to have problem reading social skills and social cues, but the inconsistencies found in the classroom still kind of confuse him a little bit. I did suggest to the parent that these were things that were appropriate to discuss in an IEP meeting, and maybe even to the point of discussing this with someone there to assist. Overall, though, the child does have a good prognosis. He has shown that he's got the ability to learn these things. He's still pretty young, and with the right type of IEP and implementation of the IEP, I think that he has a good chance of learning to adjust his behaviors to be successful in a mainstream setting. I think I noted in my paper that mom is considering removing him from the school and also maybe finding another job herself. She's considering going back to a public school environment. We discussed what that might mean. Although a charter school is a public school, they sometimes, by their charter, approach things differently. Overall, for me, this was a good experience, seeing how this young man acted both in home and at school, and seeing through using the assessment instruments and looking at the various antecedents and the consequences between the various people working with him, there was some indication there that with some adjustments he could do very well. This has been a good class for me, and I thank you for the opportunity.